Welcome, everyone. It's a pleasure to have you all here. Every year since 1954, we have marked Veterans Day through ceremonies, pageants, parades, and other events designed to honor the men and women who have served this nation so selflessly in the armed forces. And we will do so again across the nation tomorrow. Our servicemen and women are the very best demonstration of our nation's greatness. Folks who have stepped up, have taken the oath, have put on the uniform so that the rest of us can live in a country that is safer and more secure. For their service and sacrifice, warm words of thanks from a grateful nation are more than warranted. But warm words are not nearly enough. Today, together, we are calling on Congress to do more than honor our veterans. We are calling on Congress to act. Today, we are calling on Congress to stand up for our veterans and to have their backs just as they have had ours. For the veterans who have carried out their duty as a grateful nation, we must do more. And because of what they have done for us, their health and well-being must always be a priority. Every day, hundreds of thousands of dedicated public servants at the VA help us honor that commitment. At VA hospitals across the country, many doctors and nurses work hard to deliver world-class care. But we all recognize that there are improvements that can be made. We have to go further to improve the VA hospitals, to reduce the long wait times, and to ensure that all veterans, every single one, gets the care they need and the care they deserve. Today, together, we are introducing legislation, Senator Rounds and Senator Warren and Senator Tillis and myself, called the Veterans Healthcare Staffing Improvement Act to help meet that goal. This legislation makes common sense changes in staffing policies to improve veterans' care and working conditions at VA health facilities across the country. First, it would establish the Docs to Doctors program, increasing the ability of the VA to recruit veterans who have served as healthcare providers in the military and are leaving the military. And this is just common sense because we hear again and again from returning veterans that they want to have a new mission, and they want to continue helping their fellow Americans and their communities. What better way than allowing a veteran with a medical background to have a facilitated path to serve their fellow veterans in the VA system? It is a win-win to cut red tape so that these doctors and other healthcare providers can transition seamlessly from the military system to the VA system. This legislation also creates uniform credentialing rules, which surprisingly are not uniform across our nation. And it eliminates the re-credentialing when veterans or when the medical personnel move from one hospital to another, which has been an endless source of frustration and delays, or when they want to split their time between two VA hospitals. And it provides full practice authority to advanced practice registered nurses and physician assistants in the VA health system, which will help to make more primary care providers available in rural areas. Writing these measures into law will make the VA more effective and more efficient, make it easier for the VA to achieve the staffing levels that they need to do right by our veterans. Caring for our veterans in an area where Democrats and Republicans should always be working together, where the House and the Senate should always be working together, and it's good, therefore, to be launching this with this bipartisan coalition. I want to note that my Oregon colleague, Congressman DeFazio, has been working side by side with my team confronting some of the challenges we've seen at VA medical systems in Oregon, in medical centers in Oregon, and he will be introducing companion legislation in the House next week. And I do hope that we will have colleagues in both chambers from both parties rally together to make sure that every veteran has full access to the care and benefits that they have earned. And now I'm delighted to turn this over to Senator Mike Rounds.
Thank you. Ladies and gentlemen, let me just begin by sharing with you that the VA system itself did not break overnight. Most certainly we can make improvements in it. It doesn't mean that we're going to make everything get well in a very short period of time, but you have to begin someplace, and that means delivering results. The Veterans Healthcare Staffing Improvement Act makes common sense changes in staffing policies at the VA to improve veterans' access to care and improve working conditions for the VA healthcare providers. It reduces bureaucratic obstacles to make it easier to hire medical professionals coming out of military service and allow advanced practice registered nurses, or APRNs, to provide a wider range of health care to patients to expand care in rural areas. In South Dakota, we have a similar health care delivery practice which is in place right now, and this bill will make certain that our vets can benefit from the same high-quality care. This bill has received support from nearly 30 outside groups, including the VFW, the Vietnam Veterans of America, the Military Officers Association of America, and the National Guard Association of the U.S. As a member of the Senate Veterans Affairs Committee, I'm committed to making reforms at the VA that will benefit veterans, especially those in rural areas who may have to travel hundreds of miles just to get adequate health care. The VA's well-documented challenges providing timely and quality health care to veterans stem in part from a shortfall of tens of thousands of medical staff. In some cases, VA employees have even picketed over staffing shortfalls that leave them facing difficult and stressful work environments. This legislation will help veterans by allowing them to receive health care closer to home from qualified APRNs and physician assistants, meaning they won't have to drive miles away to a major VA hospital for services. I want to thank Senator Merkley for his leadership on this bill, and I look forward to working with him on getting it passed. I would encourage all of our colleagues to consider working with us in the Senate to support this very common sense measure in attempting to take those very first steps in reforming the VA and giving them the tools necessary to make the important changes so that our veterans are the recipients of better health care than what they have today. Thank you.
Well, thank you, Mike, and let me echo what's been said. First of all, to Mike and Tom and Jeff, the fact that we're doing this together. We may be actually seeing a continuation of the burst of sanity that we saw last week when we avoided defaulting on our debt and then potentially avoided the stupidity on steroids, which is sequestration, from coming back about. I think it's very timely that we announce this today. Tomorrow's Veterans Day. I think Jeff made the comment that we all need to pay an extra tribute to the men and women who keep us safe. I know my favorite veteran is my 90-year-old dad, who was a World War II Marine, served on Iwo Jima, and I get an ear from him regularly on a host of topics. One of the ones that I got the biggest earful was about a year and a half ago when some of the outrageous stories started popping up about the wait times at VA facilities all over our country. It was an embarrassment. It was a disgrace. It was, again, an area, though, where Congress did come together with a sizable amount of resources to help make some of the fixes that Mike's talked about in terms of our needs to improve quality of care and decrease the wait times at our veterans care facilities. I can tell you we had one of the facilities we have in my state in Virginia, the Hampton facility, had actually some of the worst wait times in the country. The good news is by staying on top of that facility, and the VA actually sent a SWAT team in, we've seen the wait times go from excess of 30 days down to single digits. More can be done, but I think this kind of relentless pressure that elected officials and others can bring can help continue to make sure that veterans get the health care in the quality health care in a timely manner. Part of that kind of exploration of what was happening at Hampton, and I imagine at the facilities in my colleagues' states as well, was a lot of this problem goes to staffing. We'd seen a dramatic decrease in providers in our Hampton facility, and that's when the wait time shot up. So this, as Jeff and Mike, I know Tom will make the point as well, this is kind of as basic common sense as you can. One, let's make sure that those individuals who've served in the military, that got that medical training, got that medical background, as they leave the military, we make it as easy as possible if they choose to transition into the VA healthcare system. Common sense, these are folks who are familiar with the unique challenges and making sure that veterans get the care they deserve, a great flow of personnel. Let's make that easier and seamless, and as Jeff said, let's make sure the uniform standards actually are uniform. Then, and particularly in rural areas, but I think elsewhere, there's a revolution going on in healthcare as we think about how can we take folks like physician assistants, some of them master qualified nurses, folks who've got advanced planning, and if they've got this advanced training, allow them a fuller scope of practice in these facilities. It will be within an area that provides, again, better quality care in a more timely fashion for veterans all across the system. This is the kind of common sense, bipartisan legislation that I think will move forward the care for our veterans, and I can't think of anything more timely when I call my dad tomorrow and wish him happy Veterans Day for me to say, hey, a group of us in both parties are actually going to make sure if our legislation passes that you and other veterans, when you go to that veterans health care facility, are going to get the quality care you deserve in a timely fashion. With that, let me turn the mic over to my good friend, Senator from North Carolina, Thom Tillis.
Well, thank you. I think to echo some of the comments that Senator Merkley made and Senator Warner made, I think in a city like this that's infamous for partisanship and sometimes gridlock, it's always great to see in the Veterans Committee how that almost never happens. I mean, how we really come together to support veterans, and this is just one good example of the kind of work that can be done when we check our partisan differences at the door and recognize there's almost nothing more important than we can do than to support our veterans. The policy that we're talking about here is pretty straightforward. It's common sense, and I think it's something that's going to do a wonderful job for getting people who are qualified. The best when I go around the state of North Carolina and I speak with veterans, there's no more common theme than the theme of I love being able to be provided care by someone who knows my own personal experience. I was down at Fort Bragg a couple of months ago, and I was at the special operations training down there where they have an advanced medical training for special operators. These are incredible men and women who are trained to fight on the battlefield. And then they have that extra skill, that medical capability, the medical training that they've received, that I know if they're in a VA facility or in some other facility in my state of North Carolina and serving a veteran, it'll raise the standard of care unlike just about anything else we can do. So I think that if you take a look at the Veterans Healthcare Staffing Act, it just acknowledges the challenges that the VA is facing. We need more medical resources in those facilities. It's a bipartisan, common sense attempt to reduce the barriers, the bureaucratic barriers that the VA, so that we can just continue to improve the quality of care and the quantity of care providers. So I'm proud to be a part of this legislative initiative, and I think that we'll get broad bipartisan support, and I expect the same kind of support for our men and women serving over in the House. And then finally, I just want to say that this is just one example of several examples that in my very brief tenure here in the Senate, I'm very proud of. People reaching across the aisle, doing the right things for veterans. And tomorrow may be Veterans Day, but I really believe every day is Veterans Day. And every single day that we serve in the Senate, we should be thinking about what more we can do, like this bill, to better serve our men and women who have served this country and have given us the great privilege to represent them in the U.S. Senate. And again, thank you all for your leadership. I look forward to working with you on moving the bill.
Thank you so much to my colleagues for sharing their stories and insights. This legislation now has over 40 organizations supporting it. And one of those organizations is the Reserve Officers Association. And Jeff Phillips is here as an Army reservist and as director of the Reserve Officers Association to share his thoughts. And we're so delighted to have you.
Well, hello, everyone. And a day in advance, happy Veterans Day. But if I may, today is the 240th birthday of the United States Marine Corps, created by an act of the Second Continental Congress on this day in 1775. And I would like anyone who is associated personally or by family ties, which means personally, with the Marine Corps to please stand up and receive our applause. Thank you. And we also have, and we may have others, but two people that I know are two military nurses, an Army nurse and an Air Force nurse. So thank you very much for your service. On behalf of the Reserve Officers Association of the United States, gentlemen, thank you very much for the opportunity to be here and for the support of our veterans' health care. ROA applauds this bill. It will improve the provision of health care by the Department of Veterans Affairs for those who have worn the uniform. And some of us as reservists are probably getting VA care, so that some of us are still wearing the uniform. A provision that is especially attractive to ROA is that it makes it easier for men and women in the Reserve and the Guard, our reserve components, to themselves serve in the VA providing health care to veterans who are enrolled for health care in that department. That's a large number of folks who have both passed through the military and are veterans with a health care background, and also potentially, since they're in the Reserve and Guard available for service, wearing civilian garb, are in the Reserve and Guard now. The Army Reserve, for instance, has 60% of the Army's medical care specialty assets. So you're starting to look at some real numbers of folks who are affected and whose entry now into the VA is tremendously facilitated by this legislation. And as the Senator said earlier, there's nothing more powerful than a veteran taking care of a veteran. So ROA says thank you, gentlemen. Thank you for your nonpartisan, patriotic service in this bill. We look forward to being of strong support and engaging others in support of it. Thank you.
And please feel free to stay with us up here, and that we may have questions that you may very likely know far more about than those of us who are members of the Senate. Are there any questions that folks would like to ask?
We did a good job of explaining.
They're 100% satisfied.
Then we appreciate so much your attending, and this launching this bill is certainly for all of us a significant way of recognizing our veterans should receive terrific health care, not just on Veterans Day, but on every day of the year. They have stood up for us, and we need to stand up for them. Thank you.